everyone, my name is Pia Gwenny Colrocolas, a first-year nursing student from Davao Doctors College, and today I'll be assessing the abdomen of my client. So the assessment of the abdomen can provide diagnostic use of gastrointestinal and genitourinary pathologies, and it can also give insight into abnormalities among other organ systems. Now, let's proceed for the pre-introductory phase. Review the client's previous medical record and the doctor's order sheet if available. This is done in order for the nurse to know the previous medical history of the client and to provide focus on the physical assessment of the patient. Now, determine the scope of assessment needed. Prepare the necessary equipment. This is done to conserve time and energy. So the pieces of equipment I have here is the examining light, the skin marking pen, the tape measure, and then the stethoscope. Now, perform hand washing and don glove if necessary. This is done to prevent the spread of microorganisms. Now let's proceed for the introductory phase. Now, greet the client politely and his or her companion if around. Introduce yourself and verify the client's identity using the agency protocol. Ask how the client would like to be called during the assessment. Establish rapport with the client. Then, explain the procedure to the client and how he or she can participate during the assessment. Provide the client the opportunity to clarify, ask, or raise any concern. This is done to elicit the cooperation of the client. Good morning, ma'am. How are you today?
I'm great.
Okay, so I am Pia Gwenny Colrocolas from Davao Doctors College, a student nurse. And may I see your wristband, ma'am? Can you state me your full name and date of birth?
Jode Victoria Olivar, February 27, 2008.
Okay, thank you so much, ma'am. So how would you like me to call you?
Jode.
Okay, so okay, Miss Jode, I'll be with you for your abdomen assessment for today. And with that, I'll be needing you to remove your clothes so that I will be able to inspect, auscultate, percuss, and palpate in the same order. Is that okay with you?
Yes.
Okay, so do you have any questions or clarifications before we start the assessment? Okay, so you don't have to worry because all the information that I will gather today will remain confidential and only be available to your healthcare provider, including me, okay? Okay, so now, ma'am, I'm giving you this gown and you will wear that so that we can start the assessment. So after that, I will be back, okay? Now, ensure the client's comfort, privacy, and confidentiality. Make sure that the assessment setting was assured to be safe, secure, and free from distractions. And also, position the client in a comfortable setting position. This is done in order to provide comfort to the patient while the assessment is going on, and also to provide dignity and have a trusting relationship with the patient. Also, ensure that the client has emptied his or her bladder. Okay, Jode, so are you comfortable right now?
Yes.
Okay, so that's good to hear now. So, okay, so Jode, you need to void or urinate first to eliminate bladder distension that might interfere with our abdomen assessment. Alright? I'll be waiting for you here. Okay, so are you done now, ma'am?
Yes.
Okay, so is it okay for you if I close the door? Okay, this is done so that no one from the outside will be able to disturb us while the assessment is going on, okay? So let's proceed now for the working phase. Okay, Jode, so before we proceed, I just want to ask if you have any history of the following, okay? So, do you have incidents of abdominal pain? No. Okay, so incidents of constipation? Okay, or diarrhea? So, like change in appetite, food intolerance, and food ingested in past 24 hours. So do you have previous problems and treatment? Okay. Thank you so much, Jode. Now, position the client in a supine position. Okay, Jode, so I'm going to assist you in a supine position. So can you lay down here? And this will allow your abdominal muscle to relax. And I'm going to cover or drape your body, your upper and lower parts with a bed sheet. So I will leave the abdomen exposed, okay? So I'll be exposing your abdomen since it is the only part that I'll be assessing for today, okay? Alright, so I'm just observing for your abdominal skin. Okay, I can see that there is no visible vascularity that might indicate circulatory tissue. You have no stretch marks either, and your abdomen is free of scars, lesions, and brushes. If there were, I'll be noting for it in its location on your abdominal quadrants. Alright, so I'm going to inspect your umbilicus for its color, contour, and its location as well, if it's deviated. So I'm going to use this examining light. Alright, so skin tones are equal to the surrounding abdomen, and also it has not deviated from the center. Alright, June, so for the next part of the assessment, I will be inspecting for abdominal contour or the profile line from the rib margin to the pubic bone, okay? So I want you to take a deep breath and hold it in. This will make an enlarged liver or spleen more obvious. Okay, so, okay, hold it. Okay, so the abdomen is flat and has no evidence of enlarged liver or spleen. Thank you. Okay, so now that you've emptied your bladder earlier, I will be measuring your abdominal girth or the circumference around your belly button. Now I'm going to mark your belly button, Joe, to make sure that it is measured in the same location for the next assessment. Okay, so Joe, remember that don't wash the mark until it's no longer needed, okay? So I will be inserting now the tape measure. Okay, Joe, so it measures 70 centimeters and I'll be documenting. Okay, Joe, so I'll be moving towards your foot to check if your abdomen is symmetric, okay? Okay, Joe, your abdomen is symmetric in a relaxed position. This time, can you raise your head for me? Joe, can you raise your head for me, po? Okay, thank you. Okay, so there's no bulging as well that might indicate herniation or diastasis. The movement caused by respiration is symmetric as well, and there is no peristaltic wave that is observed. Okay, thank you, Joe. Okay, Joe, so I'll be auscultating your abdomen this time. So I will be needing my stethoscope to auscultate for it. And don't worry, I already checked the temperature and it's already warm enough, so I'll just be cleaning this one. Alright, so I'll be lightly facing the diaphragm of my stethoscope to assess for high-pitched sound. So on your abdomen, right lower quadrant first and then clockwise. Okay, Joe, so I'm going to start now. Right lower quadrant, right upper quadrant, left upper quadrant, and then left lower quadrant. Alright, Joan, so I heard growling sounds in your stomach, and this is normal since our abdomen makes the gurgling sound and at a rate of 5 to 30 per minute. Alright, Joan, so I'll be switching the bell of my stethoscope to auscultate for vascular sounds. On the aorta first, the next is the renal artery, then iliac artery, then the last one is the femoral artery. So first is the aorta. Just do it. Next is the renal artery. Next is the iliac artery. Is the femoral artery. Okay, thank you so much, Joe. Alright, so I haven't heard any brute sounds or murmurs, which is you have normal vascular sounds. So this time, I'll be auscultating on your epigastric and umbilical regions for venous flow, which is not normally heard on those areas, so I'll start now. Alright, so venous flow might indicate hypertension. So first, I'll be auscultating for your epigastric region and your umbilical region. Epigastric region and then umbilical region. Alright, I didn't hear any whining noise or venous sound, Joe. Okay, so for the last part of auscultation, I'll check for friction rub over the spleen and the liver using the diaphragm of my stethoscope. Alright, so I'll be checking from the lower rib cage from right to left. Alright, Joe, so for the last part of auscultation, I'll check for friction rub over the spleen and the liver using the diaphragm of my stethoscope. Alright, so I'll be checking the lower rib cage from right to left. Okay, so there is no friction rub that might indicate infection. Okay, Jode, so for the next part of the assessment, I'll be percussing your abdomen for resonant sounds. So I will be starting from your right lower quadrant, then moving to the right upper quadrant, and then clockwise, okay? Okay, so I'll start now. Okay, so thank you, Jode. For the next part, I'll be assessing the span or height of your liver. So I need to determine the lower and upper border first. So to determine the lower border, I will start at the right lower quadrant along the midclavicular line, and then I'll percuss upwards until there is a change from tympani to dullness. All right. So I'll start now. From right up lower quadrant. Okay, so I'll be marking here. So can I mark it now, Jode? Okay, so this will be your lower border. Okay, Joe, this time I want you to take a deep breath and then hold it in. Then I will percuss it, okay? So you inhale and then hold it in. So I'll be percussing downwards from the dullness earlier on the lower border of dullness. Then I'll mark it there, okay? So I'm going to percuss now. So I'm going to mark it now. So this will be your, this is the descent of the liver. Okay, so to determine the upper border, I will be percussing from the upper right chest along the midclavicular line, and I'll be starting from the right nipple area. All right? Okay. So, okay, Jode. Okay, so I'll be marking it now. This will be the upper border of the liver. Thank you so much, Jode. Okay, Jode, I'll be repeating the percussion of the liver, this time along the mid-sternal line or the center of your body, alright? Okay. Okay, this will be the lower border of dullness of your liver. Okay, then I'll start from the top for the upper border. Okay, this will be the upper border of dullness of your liver. So I'll be marking it. Okay, Jode, since we determined the upper and lower border, I'll be measuring it now. Okay, so I'm going to measure it now, Jode. Okay, so 8 centimeters. So now I'll be percussing this time for your spleen. So for percussing it, I'll start from the posterior to the left mid-axillary line, okay? And I'm going to percuss it downwards. And then I'll be moving downwards until I feel the change from long resonance, splenic dullness. All right? Okay. So another method to percuss the spleen, we will start from the anterior mid-axillary line. And then we'll start now. So upon percussing your skin, the observation indicates that there is no sign of enlarged spleen. Okay, Joe, next part I'm going to do is a blunt percussion to assess for tenderness, starting with your liver. So I will assess you to a safety position, which is a standing position. So can you do this for me? Place here. I'm going to look at the blanket. And then what I want you to do, Joe, is to place your left hand fist against your lower right anterior ribcage. So I'm going to strike that using the ulnar side of my right fist. So you will tell me if is there any pain, okay? Okay, so there is no pain and no tenderness found on your liver. So I'll be doing the same thing at your back for blunt percussing your kidneys. So I will strike now using the ulnar side of my right fist. Just tell me if there any pain, okay? Face there. Just tell me if there any pain, Joe. Is there any pain?
No.
Okay, so there is no pain. Okay, Joe, now you can lie down and I'm going to cover the upper body parts of yours and the lower body parts. So I'm just letting the abdomen exposed, okay? Going to drape you now. Jode, so now I will be performing light palpation to assess for tenderness and burning. So I will begin now palpating on your non-tender abdominal quadrant in your right lower quadrant. So I'll palpate for at least 1 centimeter deep. Then I'll be moving from one quadrant to another by lifting my finger gently. Okay? I'm going to start now, Jode. Okay. So the abdomen is not tender and soft, and there is no guarding as well. So this time I'll be performing the palpation, but I'll be doing it deeper now. Just tell me if you feel anything, okay? This is done to evaluate subtle muscles, and if I find any resistance, I might have to take note for that. And I might have to use bimanual deep palpation using both of my hands to palpate deeper. So just tell me if you feel any pain, okay? You don't feel any pain? Okay, so this for this case, there's no severe tenderness or pain that may relate to trauma or enlarged organs. So now I'll be compressing to a depth of 1 centimeter of all quadrants to assess for masses. Alright, so there are no detected masses that I should be noting as well. So this time I'll be palpating for your umbilicus for swelling, bulges, and masses. So center is not too soft. For potential herniation, there are no hard node as well. So this time I'll be palpating for your aorta to assess pulsations of abdominal aorta. So I'm going to use my thumb and first finger, and I'm just palpating deeply the epigastrium slightly to the left. Okay, so tenderness is found with a moderately strong but regular process. Okay, this time I'll be palpating for your liver to assess for consistency and tenderness. And then that may indicate vascular engorgement or tumors, and I'll be facing my left hand and at the back of the 11th and 12th ribs, and then the other hand pointing towards your head. Okay? And what you're going to do is to inhale while I'm pushing my fingers upward and inward, then relax. Okay? So I'm going to do it now. So inhale. Relax. Okay. So the lower of your liver is filled, and it is smooth and even, and no tenderness also is found. So this time I'll be palpating hooking. I'll be curling my fingers like a hook to assess for enlargement of the liver. So I want you to take a deep breath while I hook at the liver area, okay? Inhale, then relax. Inhale, then relax. Thank you so much, Joan. So there is no tenderness is found, and that may indicate hepatitis and other liver diseases. Now I'll be palpating your spleen. So I'll be assisting you to a side-lying position, and you have to face towards me, and I'll be palpating it. There are two methods. I'll be using the second method, and I'll be palpating it by moving it downward and forward. Let me know if you feel any pain, alright? So you do a side-lying position. I'm going to assess you. Okay, so just tell me if you feel any pain, okay? Okay, Joe. Okay, so spleen is not palpable. Alright, so no crane as well. No tenderness is found that might indicate enlargement of these movement. Okay, this time, Joe, I'll be palpating for your kidneys. And I'll be placing my left hand at the back to provide support, and my right hand at the fossa margin. Then I want you to inhale and exhale. I'll be gradually removing my fingers, alright? Okay, so I'll be doing the same thing on the other side as well. So I'll be providing support using your right hand. I want you to take a deep breath. Inhale and exhale. Okay. Let me know if you feel any pain, alright? Okay. Thank you, Joe. So, no pain is found, kidneys are non-palpable, and no indication of enlargement and not tenderness is found. No tenderness. Next, I'm going to do is to palpate your symphysis pubis, and I'm going to palpate it using the heel of my palm. So, in doing this, I'm going to put my palm first in your abdomen area, and then slowly put it downward. And let me know if you feel any pain, okay? Let me know. Okay, so far there is no pain and no indication of tenderness. So next I'm going to test is for psoas sign. So to assess this, let me assist you to a side-lying position. You're going to face there, Joe. Okay, thank you. I'm going to get the blanket. And then I'll be extending your leg, and let me know if you feel any pain, okay? Do you feel any pain?
No.
Okay, thank you so much, Joe. So, you can now so do a supine position. So, there is no indication of pain present that may indicate irritation of the ellipsus muscle or inflamed appendix. Okay, Joe, let me assist you. So, next I'm going to assess is for obturator sign. So I'm going to drape your one leg. Okay, so this time I'll be flexing your hip and knee as well as rotating your leg internally and externally. So let me know if you feel any pain, alright? Okay, so I'm going to drape your one leg only. So just tell me if you feel any pain. Feel any pain?
I did not feel any pain.
Okay, thank you so much. Alright, so no pain is present that may indicate irritation of the obturator muscle or perforated appendix. So I'll be draping it. Okay, Miss Jode, we're almost done. We're now at the last part of the assessment already. So to test for appendicitis, I'll be assessing for rebound tenderness while palpating your appendix at the 90-degree angle. Okay? So I'll be exposing your abdomen now. Do the assessment. Okay, so just tell me if you feel any pain, okay? So I'll be releasing it now. Okay, Jode, may I ask which hurt more, when I press it or when I release it?
Actually, I did not feel any pain at all.
Okay, so no abdominal pain and no rebound tenderness is found on your appendix. Going to assist now. Okay, you can stand now. You can sit down. Okay, Jode, I will let you wear your clothing now and I will be back if you're done, okay? Okay, Jode, I can see that you're now done wearing your clothing. So I'm going to summarize the findings earlier. So upon us inspecting your abdomen, there is no presence of dilated veins or observed no stretch marks, lesions, or any rashes. There are no scars observed as well. Also, your skin tone seems to look normal and your abdominal movements are symmetric upon auscultating your abdomen. I also observed a series of intermittent soft clicks and vergus, which is normal. So there are no broods or low-pitched murmurs like sounds are heard upon auscultation of your abdominal aorta, urinal, your iliac, and your femoral arteries, which is a good thing. Also, there is no venous hump and no friction rub over the liver or spleen was observed, which is considered to be normal. Also, upon percussing your abdomen, I observed that your vertical liver span is at 8 cm, which is within the normal range. Furthermore, lower liver of the liver dullness and descends from 6 cm below your costal margin, which is also normal. Also, upon percussing your spleen, I observed that there are area of the dullness of your spleen is about 7 centimeters wide near your left 10th rib, as likely to steer to the mid-axillary line. And also, I observed that your lowest interspace in the left anterior axillary line has a tympanic tone, which means that there are no signs of enlarged spleen. The tenderness or pain is observed upon blunt percussion of your kidney and your liver. So for the palpation of your abdomen, I observed your abdomen is non-tender and soft and no guarding as observed as well. So no palpable masses are present, desiccation, size and shape seem to be normal, and no tenderness was observed. You also have no signs of swelling, masses, or bulges in the umbilical and the surrounding area that the aorta is about 3 centimeters wide with a regular and moderately strong post, which is also normal. The liver seems to be firm, smooth, and even consistent, which is a good thing. No sign of cholecystitis. The spleen, kidney, and urinary bladder seem to be normal. No pain or exaggerated sensation was observed, and also at the last part of our palpation earlier, you are also negative for SO sign and the obturator sign. And also no presence of rebound and tenderness in your appendix. Alright, so all in all, Jode, I observed a normal finding in all the procedures that we performed during the assessment. So all these data gathered will be transferred to your physician. We will just contact you for further examination, okay? So do you have any questions or clarifications before we end the assessment, Jode? Okay, so Miss Jo, that's all for today. Thank you so much for your cooperation and have a great day ahead. Now, document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.